It contains over 700 magical and medical formulas covering treatments for everything from crocodile bites to heart disease to dental problems to mental illness. The Ebers papyrus dates to approximately 1550 BCE, but the medical knowledge it contains is almost certainly far older, compiled from earlier texts that may go back to the time of Imhotep himself. Together, the Edwin Smith papyrus and the Ebers papyrus form a portrait of a medical tradition so advanced, so systematic, so remarkably modern in its thinking, that we must ask not how did ancient Egypt achieve this, but why did the world forget that they did? The Edwin Smith papyrus is dated to approximately 1600 BCE, but most historians believe the knowledge it contains is much older. The text itself contains archaic words and phrases that suggest it was copied from documents going back as far as 2600 BCE to the time of Imhotep. The scroll is written in hieratic script, a cursive form of hieroglyphs used for everyday writing. It measures approximately 4.68 meters, about 15 feet in length, and it is unlike any other ancient medical text ever found. It is what makes the Edwin Smith papyrus so extraordinary. It is organized systematically, logically, scientifically. The scroll contains 48 detailed case studies of injuries, primarily trauma injuries to the head, neck, chest, and spine. For each case, the text provides a title, an examination process, a diagnosis, a verdict, treatable, possibly treatable, or untreatable, and a treatment plan. This structure, examine, diagnose, determine treatability, treat, is not guesswork. This is not prayer. This is not magic. This is clinical medicine, systematic, evidence-based medical reasoning recorded in Africa over 4,000 years ago. Now we come to one of the most astonishing facts in the entire history of medicine. A fact so remarkable that when modern neurosurgeons first read the Edwin Smith papyrus, many refused to believe it was real. The Edwin Smith papyrus contains the first written description of the human brain in history. Case number 6 in the papyrus describes a patient with a compound fracture of the skull. The Egyptian physician examines the patient and describes, with remarkable accuracy, what he observes on the surface of the brain. He notes the convolutions, the folds,